we wear particular set of colors. Yes, Radha. So she's born as a girl. The next day, then she's married. Then something, something, something. And in each day, she is vanquishing a demon. So the demon represents maybe jealousy, maybe represents anger, maybe represents lust. Okay, like that. So there are 9 days. So people fast in these days. And I was not much into fasting because I had an educated mother. She used to not do all these things. So I don't have that religiousness into me. She used to just say, be kind to people, and there were patients there who used to come, and she used to not charge them.
No staff fasting. Me also.
Yes, she
No
used to do
fasting.
more of, you can say, being kind to people rather than visiting temples. So even I don't have it. So last year I used to attend, and people used to say I'm water fasting, I'm air fasting. So you think I did it? No. But this year, today, I've started with the water fast. Okay. And yesterday I had my lunch at 4 and still I'm fasting. So people think that fasting means what? Juices, kuttu ka atta, sabudana ka khichdi. Then you can be having fruits the whole day, but that is not actually a fast. Okay. Do you know why we are fasting? In this 9 days, Carol, we are not allowed gluten. So even for 9 days, if you don't eat gluten, the gut repairs itself. I'm telling you all the scientific reason of fasting. The gut is repairing because gluten is a sticky protein. Now, I am in that group wherein there are 1000 people who are in the group, not all are fasting. But in the night, 9:30, there is a lot of sharing. So this is what I tell you. Sometimes you may not do it, but you will be propelled to do it the next year. This is what I say, as the company, so the color. Your vibe attracts your tribe. So this year I'm doing it. And last night I just mentioned to my husband that there was a lady who was 140 kilos. She had a talk. I hope we were listening to her talk. Good Maria has also joined. She was 140 kilos, and then she stayed with those people for 12 days and did an air fast and other things and all. And then she has lost 60 kilos.
That
So
is
now
a
today
lot.
also my hand is going to a cashew nut or something. Plus I'm cooking and I'm serving. But I remember that lady who shared last night. She said there are people in my house. She was a Marwadi, and there are people, like, people really entertain guests. Like, I don't have many guests coming over because I don't go also much and I don't like also. But I'm a person to myself. I'm very selective with my company. So I'll go to a friend, I'll spend a day, have lunch. I prefer that one-on-one sessions. So she was saying that I cater to people also, but I don't eat, I eat healthy. So this line has registered in my mind. That way, how this Lakshmi madam said, I can't do everything. Something I try. So your job is to stay at it and not give it up. And you will gain some grain of knowledge from anywhere.
Yes,
From
that's
anywhere
true.
you will gain. You just have. Now I went to the cobbler that day. Okay. So I saw how he was sitting. What have I taught you all about the cobbler? He sits in Badrakonasan. What we did in the morning today, he sits in Badrasan. And he has that thing where you put your shoe inside. No, that cobbler did not have that because he was not working on a shoe. He was working on a torn slipper. So he was exactly sitting in Badrasan, and his knees were touching the floor. Our knees don't touch the floor. So I came back very jubilant that I had learned something, because our teacher had told us that cobblers do not get prostate complaints because they sit whole day in Badrasan, Swatilavati. So when I went to the cobbler, I saw this. Okay. So you should also be learning to correlate. It is not just in this 1 hour you are learning. It should be moving everywhere in all spheres of your life.
Yes, you are right.
Even yoga, it's not that just 1 hour. It should be percolating in all your day-to-day activities.
Yes.
Then it has been supernatural. It has been of some value to you. Otherwise, this 1 hour, then it is just pleasing to the ears. You listen and you go, right? Yeah. Let's start with our class. So, Maria, did you climb 2 stairs? Okay, one minute. Huh?
I was in the house, some people had come home.
No, no,
So
no, no.
I
Some
was,
people, now those people have gone. So, before my class, you should have climbed 2 stairs. Don't give me
yeah.
excuses, Maria.
I'll do it in the evening now.
I will ask you tomorrow afternoon.
Okay.
Huh?
Okay, I'll do it by then.
Yes. And do not hold the railing when you are climbing the stairs.
Oh,
Yes, you should not hold the railing. It's a class on understanding sinusitis. Again, this is my favorite slide. Knowledge is power, information is ammunition, and awareness is enlightenment. The ancient maxim, know thyself, applies to every facet of human existence, especially to one's health. The prevention, treatment, and management of illness and disease becomes easier and more effective when we are aware of the early symptoms of a medical condition, how to recognize those symptoms, and then how to go about getting the right kind of treatment. So, if we are able to pick up here in today's class, how do you think sinusitis develops? It can be going from a simple cold, just a simple cold if you're getting coryza, and it can lead, if it's left untreated, it can lead to an episode of sinusitis. So this is, we'll study what are sinuses also. But what I want to tell you is pick up your disease in the first stage. Each kind of cold episode lasts for 4 to 5 days, whether you take treatment or you don't take treatment. Okay. But you should understand why it happens to you, why it happens to children. Okay, so we pick up in the early stage, then we can nip it in the bud stage, and we don't allow it to catastrophize into something very huge. And then the doctor tells you you need to get operated or other things. Okay, so, but as Carol explained so well, we should be mindful about what we are doing. We should not take the diagnosis and the management in our hands. We should. This is a very wrong thing to do. The doctor is trained to manage things to you, so you should be consulting a doctor regarding your complaints. But run quickly to the doctor. Now, we should be learning, today's objective is understanding that sinusitis is usually caused by inflammation of the cavities around the nasal passages. Okay, I will be telling you what exactly is a sinus. Sinus is a cavity or a hole or a khadda, simple like a cavity, a concavity, which is inflamed, caused by inflammation. And learning, we will be learning that triggers may be a simple cold, or you may be exposed to allergens. What are allergens? In the air. The allergens are in the air. So when you do an allergy test, it tells you that you are you are having an affinity towards this kind of pollen or this kind of grain or this kind of pet hair or pet dander, like that. You get a whole list. Hmm? And it can be due to some infection, some fungal infection, some bacterial infection, or it can be due to growth. Now growth means, can be a polyp, okay, can be a deviated nasal septum. So I have slides for that. Septum should be straight, but it can be deviated or little crooked and some portion of the nose. So that means one nostril becomes big, one nostril becomes smaller. Also, growth can be adenoids. Now, what are adenoids? Anybody knows? Hello, Pushpa Bajaj. So we have new people today. DF Chip.
Adenoid is just next to the tonsils and
Huh,
the throat.
okay. So they are not next.
Ma'am, of my singles, my one nostril becomes small, another is normal. The affected one has become smaller. Still, it's bothering me.
So
4 years over, still I am having that problem.
so you should be doing a lot of Anulom Vilom or
Okay.
Nadi Shodhan. Nadi
Okay.
Shodhan.
Okay.
Before Nadi Shodhan, you should do single nostril breathing. What is
Okay.
single
Chandranadi.
Chandra Nadi or Surya Nadi both?
Okay. Thank you.
Okay, so Pushpa Bajaj and DF Chembur, Anuradha, if you don't follow, you can unmute and ask. I have not muted anybody. So what I was talking about, how the adenoids we were talking. So Radha madam, you're right in one thing, that they are made up of the same lymphoid tissue. What do you mean of the same lymphoid tissue? That these tonsils are also lymphoid tissue. They are the watchmen, they are the gatekeepers, they are the gatekeepers, they keep the infection here. But we get scared because they get inflamed. Inflamed, they become so huge that sometimes they even kiss each other and the child can't breathe, so we feel we should get it operated. Sometimes there are these crypts, the gyri, like that, grooves on top of the tonsils, because they become huge, inflamed, and in between those grooves there is pus which is accumulated, and it is very painful. The child cannot eat anything, cannot even speak. But it's a good idea not to be extracting them, and simple thing like salt water gargles can reduce the inflammation. I am not saying cure the inflammation. Okay, there are, you need treatment for that, but a little thing which can, that inconvenience can be reduced, right? Similar to this lymphoid tissue, there is something in the nose. Adenoids are again lymphoid tissue in the nose. They get inflamed, they get big in who? In children. Haven't you seen those children who are having Down syndrome? Their faces are mongoloid. Okay, haven't you seen that their noses are little smaller than our noses? They are like, it's known as a saddle nose. What is the meaning of a saddle? Have you ever sat on a horse? So the saddle is like this, for you to sink your buttocks into it, right? The front portion and the back portion is up. It's like this, like a C shape, like a bowl. Similarly, their noses are also like a saddle shape. Now, all this occurs because their adenoids are inflamed, and these little children cannot breathe through the nose. So, what is the alternative they are left with? They have
Mouth,
to
breathing
breathe
to the
through the
mouth.
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 Also, then this arch gets little exaggerated. It's not developed well. So it's like a conscious cycle, and mouth breathers are constantly sick. They will have a lot of cold coryza also. In the asthma camp, in the last two slides, when I was explaining about the nitric oxide, can anybody remember and tell me what did I tell you about mouth breathing and what did I tell you about nasal breathing? Who was there in the asthma camp? So remember, I told you all that when we are breathing through the nose, I am activating my diaphragm. That breath reaches so low down to the diaphragm. But when we use the mouth, we are not activating the diaphragm. So take a minute and do it. Take one breath with the mouth, close your nose, and one breath with the closed mouth, you take with your nose. And see, are you able to activate the diaphragm? Anybody out here who does not know what's the diaphragm can raise your hand. I will explain. Is there a difference? Did you all take one breath? No? No. Do it.
When you take from the mouth, the diaphragm don't move. That when you take in the nose, it goes up like this, pushes.
So there is better movement of the diaphragm.
Yeah.
In the nose. One more thing, when we breathe through the nose, what happens? We activate,
Nitric acid, huh?
yes, we activate nasal nitric oxide.
Yes, it.
Okay, nasal nitric oxide.
See, all these things I learned from your class. I didn't know anything about this. Thanks.
I didn't know. When I became a doctor, I didn't know.
Yeah.
After Get Set Up, I came to know.
Yeah, I wanted to become a doctor. My parents didn't allow me to go for that. That is the problem.
Believe me, my doctor friends don't know.
Yeah, still I admire doctors.
It is very interesting. It's very interesting, but then
Yeah,
you should have that unsatiable desire.
yeah. Dissection. I don't know. Zoology student, I used to enjoy dissection. I used to enjoy that.
Yes. So when I'm sitting in some party or something, you should see how bored I get. But when I'm teaching, you should see my eyes twinkle. When I learn something new, I really feel nice. Okay, chalo, let's proceed. Yes, so triggers can be anything. Differentiating between acute and chronic sinusitis. So acute is just which has come 3 to 4 days. Chronic sinusitis is 4 to 6 months. Can be even 3 to 6 months. Hmm? Now, if you're struggling with chronic sinusitis, no remedy is working, and you're popping in antihistaminics, then what is the problem? Now, let us understand what exactly are antihistamines. So, anybody can tell me your Sedzine, your Sinarest. Why do you start feeling sleepy after you take सर्दी की दवाई? Huh? You feel sleepy, no?
Yes.
Antihistamine, if we take, what happens? The sneezing, everything comes down.
Okay. So what happens is there are cells in our body which are known as the mast cells. MAST. Okay. The body is very scientific. It is flawless. So these mast cells secrete a lot of histamine. Okay. Now this histamine, what does it do? It gives you that urticaria. Do you know what is urticaria? In some
Yes.
language, call it as pitta. Pitta बढ़ गया है.
Yeah.
Huh?
I am the
That
worst
thing and
patient of urticaria.
Yes. So this histamine can also cause coryza and cold. Right? So these medicines have antihistamines. Means they suppress that histamine for some time. But again, once the medicine effect is gone, again it comes. Then you have to take the second dose also. So that's why for my patients, I always tell them have a lot of liquids, have a lot of kokum sharbat. So kokum, what they call kokum in English, how will Carol understand? What is kokum in English? I don't know. Tasneem Pitalwala, you know what is histamine in English? Kokum in English. Histamine is English only.
And I think it's called kokum only.
It's kokum only, no? So there is some plant and those leaves. Is it the leaf or is it the
No,
seed?
no, lotus seeds.
No,
Lotus
these are
seeds.
flowers,
No,
flowers,
no, it's
How
not
many lotus
lotus.
seeds? Lotus.
it's
flowers.
a fruit. Fruit.
Ma'am, it is from lotus.
It's not a lotus thing, no.
No?
It's a berry.
It's a
It's a
berry.
fruit we get
And
we
these
get
are
we get in
Lotus.
Konkan.
Star.
these
Remember?
are the dry flowers of kokum plant.
Okay. So because it is very sour, what do you think it has? What do you think Amla has? What do you think lemon has?
Citric
Vitamin C.
acid.
So if your vitamin C levels are good, then you cannot get cold.
Cold.
Okay, that's why it is always advised have juice of Amla every day. Hmm? Or you will have to take those tablets, those Lindsay, those QC, those chewable vitamin C tablets. Right? So this is not a long-term way. You just go on popping antihistamines. It's not usually a good thing to do. What is the learning objective? It is usually self-diagnosable. There are lab tests. You don't require lab tests, but to understand whether your sinuses are full, you require an X-ray, and sometimes imaging is also required. Okay. So, what can the symptoms be, and how can you understand if you are experiencing sinusitis? So, the symptoms can be you can be experiencing headache. You can also be experiencing facial pain. What do you mean by facial pain? What do you mean by facial pain?
Pain on
Along
the
with the
face.
sinus,
Pain on the face.
they will have pain.
Pain means
Along with
pain on
the
the face, but what? How is it diagnosed? It means facial pain means pain on the face. Okay, but what is the meaning of what is this trying to tell you? So, how will the doctor diagnose you? First thing he will tell you is you put your head down, hang it. Are you getting pain? That means your sinuses are full. If you hang your head down and you get pain, that means the sinuses are full. Secondly, he will face you and he will apply his pressure with the thumb on the sinuses. See, he knows where the sinuses are. This is, I'm explaining to you each sinus. I will explain to you through a picture. He knows this, the temple area. He knows. So when you apply and you start getting some amount of tenderness, maybe not complete full blown pain, but some amount of tenderness, that means your sinuses are full. Okay, that means your sinuses are full. So symptoms include headache, running nose, okay, a lot of phlegm coming out, and nasal congestion. Obviously, the nose gets blocked and you're having difficulty breathing. Next, acute sinusitis usually does not require any kind of treatment beyond symptomatic relief with pain medication, nasal decongestions which help to reduce the congestion, and nasal saline rinses. What is nasal saline rinses?
They put
Jalneti.
saline in the wall
Jalneti.
and
So
then
should
push
you
it
be
in.
doing Jalneti when you have the coryza attack? Tell me. Good idea to be doing Jalneti when you have the attack of cold coryza. Never ever do
No.
Jalneti during the cold, because the sinuses are open. It can even go up to the brain. The nose is a connection of your brain. Followed? Huh? See, here no, till here. The nerve endings of the brain, they rest here. After Jalneti, some people tell you that my vision has improved. I did Jalneti for 2 months, my vision has improved. Because here the optical nerves are there, the eye nerves, optic nerves. The Jalneti, the water goes and gently stimulates those nerves, the nerve endings of the brain. I have also told you that the text from where I had learned, it says that all the lunatic asylums, what are lunatic asylums? Pagal Khana.
They treat
Yes, they
psychiatric
can be
patients.
healed by just teaching those people, the prisoners, not prisoners, the patients. They are not prisoners, they are patients. Okay, they are mentally ill patients. If we just teach them Jalmeti, then they become sane. That insanity reduces. Why and how does Jalniti work so deep? It's because here also the brain nerve endings are there, here, at the root of the starting of the nose, the root of the nose. And when the water goes, which is a little warm, which is a little salty, it goes and stimulates those nerves every single day. And those nerves, the connections, the synapses, they get established. What does it require? Just a gentle stimulation. Don't we tell y'all, do the sudokus, do the exercises well every day, because your brain needs stimulation at your age to work well. So Jalniti is also known as nasal irrigation. It is also known as nasal douche. It is also known as nasal toilet. Okay. Now there are neti pots. It's known as neti, jal neti. There are neti pots. So people just put it like this, and the water comes out from the other nostril. It can come out from your mouth. It can come out a little less than what you have inhaled. But I do not like that practice. I remember from, yeah, last year we used to teach. I used to teach all Jal Niti. I used to take the laptop in my washroom on a ladder, and I used to do the whole procedure for you all, because when we do it with our palm, okay, we take the water in the palm and then we inhale. What is the difference between the pot and this? First of all, I become self-reliant. Suppose I'm flying. I can't say I've forgotten my Jalneti pot, so today I will skip Jalneti. So you can use your own hand, the palm like this, and inhale. What is the difference? Any old student, senior student from 2, 3 years knows, you can say.
if you have the pot, it will be precisely getting in properly.
If we take
When
in
you
the
do
hand, it
this,
may not come out directly. It will go and make you do like this. With the part, it goes like this and comes back like this.
No. So which is superior? My hand is superior or the jalniti pot is superior?
Part is superior. No? In
Ma'am, you
Ayurvedic,
don't put
that's what they do.
excess water in the
Yeah,
nose
I tried
when
part.
you are doing with palm.
Yes. So this I didn't know only, Neeta Dalal, that you will only inhale how much you can. Whereas the Jannati pot will go good, very good. I had not thought of this thing. You'll stop because you can't only in one inhalation, you can only suck that much of water. Okay, so let me tell you that the palm is superior technique. One reason, if you all tell me, I'll be very happy. Come on, why? Neeta Dalal.
Because
Sorry,
the
ma'am. What
muscle,
did you say?
because
I
then
didn't.
sorry.
Cause
When we inhale through the palm, our muscles also work.
which muscles? Hand muscles, palm muscles,
No, nose.
nose muscles. So this inner side of the nose, okay,
Yeah.
yes, is
Yes.
different, and the lower side of the nose is different. Haven't you seen it starts burning this side? The lower side of the nose is very different. That is the base of the nose, and the roof of your mouth is very different from the wings of your nose. These are the wings of the nose. They are made of different tissue. So this lowermost part is the most sensitive, and it is made up of erectile tissue. What is erectile tissue? The tissue which contracts on sensitivity.
It is little more reddish in color inside here. No?
Red will be inflammation. So the
Okay.
way in our body, which is the erectile tissue, the nipple, it contracts and it releases. Okay, so that erectile tissue, the penis, similar is the base of your nose. Now, next time you are eating something very pungent, eating something which is very, very, or smelling something very offensive, the odor, see if that base of the nose is giving you that smell, or is it the wings of your nose, and then you will be able to differentiate that the base is more sensitive. Clear? Come on, let's go to our sinusitis. I'm telling you all different things. Chronic sinusitis may require antibiotics. Not a good idea, because I told you all antibiotics, if a lady takes, it takes you how many days to regenerate your gut flora? How many months? How many years? One
3.
course of antibiotics, 18 months. Second course, 2.4. Okay, so it's better idea not to be taking antibiotics, because they ruin or they kill your gut bacteria, and new gut bacteria takes a long time to be growing. It takes a long time. So what exactly is sinusitis? It is an inflammation of the mucous membrane of the paranasal sinuses. Okay, the mucous membrane gets inflamed, and the mucous membrane is made up of cells which are known as the mucous cells or the goblet cells. Goblet cells, when they are inflamed, they start secreting a lot of mucus as an inflammatory response. Pan sinusitis. What is pan India? Means full India. So pan sinusitis is infection of more than one sinuses. Okay. Rhino, the rhinoceros is also named because the rhino means nose. Rhinosinusitis is referred to an inflammatory disease of the nose as well as of the sinuses. It is a common condition and a complication of 5 to 10% of upper respiratory infections in children. It affects 1 in 8 adults per year. Now, because these upper respiratory infections occur in children, so till the child is there, we have a separate gland which is known as an immunity gland, which is known as the thymus. Okay, that is the thymus. Because children fall very sick. See, their ear, behind the ear also, lymph nodes are inflamed. So Manjulata, Manjusha ma'am, you're not a newcomer. I've seen you before. Are you a newcomer? I've seen you before, I think. So the thymus produces a lot of antibodies to save the child. Now, once the child grows big, who takes up the job of the thymus? Can anybody tell me? The thymus goes on becoming small, it regresses. And who takes up this immunity job?
Lymphoid tissues.
The spleen. The spleen. Okay, lymphoid tissues are there in the whole body, but the spleen takes it. Let's understand more. Yeah. Then, sinusitis is characterized by inflammation of the lining of the paranasal sinuses, or the mucous membrane is the same thing as lining. Because the nasal mucosa is simultaneously involved, and because sinusitis rarely occurs without chronic rhinitis, rhinosinusitis is now the preferred term for this condition. Okay, sinusitis occurs along with the nose mucous membrane also getting inflamed. Now, what exactly is chronic sinusitis? It is a long-standing infection of the paranasal sinuses, recently defined as persistent symptoms and signs for 8 weeks or 4 episodes per year of sinusitis, each lasting for 10 days or more. There is a hypertrophic change in the mucosa evident in the computerized tomography or the CT scan. What is the meaning of hypertrophic changes in the mucosa? It becomes thick because it proliferates, it becomes thick. It may follow an acute attack if not properly treated, or it may be slow, insidious in origin. So acute sinusitis can be going into a chronic sinusitis, or it can be of a slow origin. So, a person who suffers from sinusitis may complain of the following symptoms: thick nasal mucosa, I told you it hypertrophies, or a plugged nose. What do you think can be done quickly for a plugged nose? A quick tip for a plugged nose. Hey, newcomers. Bhagavant Bedi, welcome, newcomer. So, sir, if madam, I do not know, it's Bhagavant is whatever. If you have any queries, you can unmute and ask me. I see a lot of newcomers today. What is a quick tip for my nose is blocked? Give me a good tip. Just don't give me any answer.
Onion, cut an onion and smell it.
Have you tried that?
Saline water.
Yes, I've tried onion.
Inhalation.
Have you tried?
Inhalation.
Yes, yes, doctor. Onion, Vicks.
Okay. So onion fumes have what, Maria?
Steam
Huh?
inhalation.
Inhalation. Inhalation, okay.
I am member of Mahim CMC, but since I have sinusitis, I am interested. Yes, yes, welcome. You will get. But madam, you must come tomorrow also. You must come for the class because management part tomorrow 3 p.m. Huh? Today we will just discuss. And I also live in Mahim. I'm Matunga, Mahim Matunga. I'm Mahim person. Okay. So the quick tip is boil water, sterilize the water, add a half a spoon of salt, small, maybe 1/4 spoon of salt. Yeah, I'm from Kanosa, Mahim. And put it in a nice dropper bottle. And when you're lying, just put one drop of that salt saline solution and lie down. The nose will open up. That's why in Jal Niti also we add a pinch of salt, because saline is healing the inflammation. Clear? That's a quick tip. You can try it out next time. Then, plugged nose, huh? Facial pain we discussed, the doctor will tell you like this. Fever, if the sinuses get infected, then we can be complaining of fever. We can be also complaining of headaches and a poor sense of smell. What do you mean by poor sense of smell? The olfactory nerve. Okay, olfactory is the nose, optic is the eye. Olfactory nerve also gets a little affected, so we get less smell, and a sore throat as well as a cough. Why? What can we doing? What is the mineral we can be saying? I can be asking you which deals with sense of smell, or which vitamin? You're not.
C, C,
Hmm? Vitamin C.
vitamin C.
Vitamin C over. We used to take it during COVID times. I can give you a hint.
Zinc.
Zinc. Zinc. Yes, yes. Zinc deals with the smell. And weren't we all complaining during COVID times that I can't smell? Weren't we all scared and petrified that after COVID also I'll not have smell? I used to think like that. That I'll not have sense of smell only. But it all comes back.
Doctor, my smell has not yet come. My sense of smell has not come. I can't smell.
A lot of zinc.
Okay. Because after COVID, I can't smell at all.
Me too. But now it's okay. It's coming up.
I'll have to have zinc.
And a sore throat as well as a cold. Then symptoms include headaches, running pain. Yeah, this is some slide we finished. Now this is the way the doctor is going to examine you. Here these are the maxillary sinuses, and to understand if they are tender. Now let us study the sinuses. So there are 4 sinuses in your face. One is the frontal sinus. As I always tell you, this is known as the frontal lobe of the brain. Okay, frontal lobe, and that's why when we think, we get a lot of pearls of sweat here only, because this is the thinking brain. The frontal lobe is the thinking brain, and the sinus also will be called by the same respective name. So they are frontal sinuses. Clear? Then we have something little lower, which are known as the ethmoid sinus. Here. Okay. And then we have something called the sphenoid also. In the next slide, I will show you. This is ethmoid. And then we have something which is known as the maxilla, or this is known as the maxilla. So it's known as the maxillary sinuses. 3 sinuses here. Let us understand the sphenoid sinus now. See, sphenoid is a little more behind and ethmoid is here. Okay. And that's the frontal sinus. And now see, this is the healthy sinus. They are red in color. Okay. That's your nasal septum. There are a few more slides which will be explaining how straight it should be. Okay, the nasal septum and maxillary sinus. Now see, in the inflammation, what happens? What is this yellow? It's purulent or it's pus. Inflamed sinus lining and excess mucus gathers, which goes and accumulates in your sinus, and this starts giving you a lot of pain, a lot of discomfort. Okay, not able to lie down, because when you lie down the nose gets obstructed more. You lie on the left lateral gets obstructive, this opens up. You're lying on the right side, the above one gets opened up, very uncomfortable. Okay, so again, these are the healthy sinuses, and these are the sinusitis, means excess mucus and sinus infection inflames sinus linings. So sinuses are a group of 4, and they are in pair. They are not unilateral. 4 pairs air-filled spaces that surround the nasal cavity. And sinusitis is also known as a sinus infection, rhinosinusitis, inflammation of the mucous membranes that lines the sinuses. So symptoms again can be nasal mucus, plugged nose, facial pain, fever, also headaches. We discussed this earlier. Okay, now what are this? Paranasal means around the nasal space sinuses. Acute is up to 4 weeks, subacute is 1 to 3 months, and chronic is more than 3 months. Okay, now how will you aid? This is very important slide. How will you understand whether which of your sinus is affected? We learned there are 4 sinuses, but which of my sinus is affected is depending on the pain you experience in that area. So if your frontal sinus is affected, the area will be where? It will be the forehead region, and you will be complaining of pain in forehead. Now, if the ethmoid is affected, Okay, then there will be pain between the cheeks, between the eyes, ethmoid, and pain behind the eyes, tearing, splitting headaches in the forehead. Okay, so not all headaches are plain neuralgias, they are because of sinusitis also. Understand in which area, that means that sinus is affected. Maxilla is here, so it's behind the cheeks, so you will be complaining of a lot of pain even when you're smiling. Okay, pain over the cheeks. And the sphenoid is deep behind the ethmoid sinus, deeper behind the ethmoid, as I told you in the first slide. Pain in front and the back of the head, because it will not be restricted only to the eyes, it will also be going backwards towards the head, back of the head. So what are the stages of sinusitis? So first is clear sinuses filled with air, making breathing easy and comfortable. Second is the nasal passages become enlarged and swollen, making you feel stuffy. Third stage, the sinuses block and fill with fluid, making breathing difficult as well as uncomfortable. Next, what is this? These are the causes of sinusitis. Why the hell do I get sinusitis? Sinusitis or inflammation of the sinuses can be caused by any of the following. One can be viral, like the ones we used to get in COVID. How does that spread? Anybody can tell me? It spreads due to droplet infection. Droplet, when you're sneezing, droplet infection. That's why we were wearing masks. Then there is bacterial infection. There can also be fungal infection. There can also be allergic reactions, and it can also be because of medications. Also, it can be because of nasal polyps. So we will learn what are polyps. They are outgrowths of your nasal mucosa only. They are of the same skin. They're just pinky reddish in color. And it can also be dehydration. Why I have put this slide is because as senior adults, keep a bottle of water, keep drinking. Sometimes you will feel you're peeing the whole day long. So add something to your water. Why? This water will be more retained if you add something, maybe a twig of mint leaves or something. Keep changing them, because they can get rancid also. Maybe a small cucumber, because when there is something, no, remember the body is very, very, very stingy. It starts seeing. Do you think the urine just comes out like this? No, the body sees. Can I take something from this fluid? Can I take something myself? Okay. So dehydration is very important to understand. Then causes can be which kind of virus? Rhinovirus, eco, or enteric cytopathogenic human organ 28 virus, respiratory syncytial virus. Bacteria can be streptococcal, pneumococcal, or staphylococcal, or pyogenes. They can be pollutants. That's why some people, if they just go to the village, they will not experience. There can be fungi, there can be respiratory infections, can be nasal. I'll just wait here and just tell you one thing before I forget. So in the chat box, somebody had written, when I asked you all a question towards the beginning of the class, that what are you going to do? Yes, when I asked you about the blocked nose, somebody had written that I will take steam inhalation. Okay, I'm not going to the chats, but I want to give you a quick tip about that. That's why it just came into my mind, so I stopped. So steam inhalation depends on the geographical condition. Are you surprised? So I am living in Mumbai. Okay, now what is Mumbai?
Coastal.
Hmm?
On the coast.
Air. Humid air.
Yes, Nita Dalal. It is an island. Mumbai is like an island. Okay, there is sea all around. Yes, highly humid. So like here I will sweat, but if I go to Lonavala, I will not sweat. If I go to Gujarat and Palitana, I will not sweat much. So it's a good idea to be taking which kind of steam if I'm in Mumbai, and which kind of steam if I'm in Gujarat, dry area, completely unhumid area, which kind of steam. The ones who have answered, try, see if you can answer.
In the humid area, dry steam, dry is heating. And in the Dry area, humid steam.
Yes. Yes, dry steam. Very good, Tasneem Bitalwala. Very good, Sudha Rastogi. Because what will happen if I take wet? How many of us, we all do it? Huh? Don't tell me we don't do it. We just take a tub and then we take it. Why do you think that will not be efficient? See, I'm not speaking of a personal case out here. This is a class on general sinusitis. So there are many things you may not like, which I'm recommending. Maybe they don't suit you. It's okay. Just listen to it. Whatever grain of truth you find in it, carry it home. That's your takeaway of the class. Okay? So, why do you think I should not be doing a wet inhalation here in Mumbai?
Because it is already humid.
Already humid, so it's going to aggravate it more. Clear? So, dry fermentation can be just maybe you take a hot iron and heat two kerchiefs, or you go to the kitchen and then you heat a tawa and then you heat whichever way. Okay, so that works much better. So you're the ones who are suffering from it, the newcomers especially, Manjula ma'am, you can be trying it out. This is what I wanted to tell you. The bacteria, pollutants, fungi, respiratory infection, nasal polyps, fracture of the sinuses. What do you mean by this? Sometimes you can get a blow on your face and you can fracture your sinus, and then the sinuses remain constantly inflamed. What is the meaning of foreign body? What's the meaning of low immunity and smoking? Why foreign body? Don't you think the foreign body will hurt? Don't you think you will take it out immediately? No, sometimes you don't come to know. You don't come to know. I remember the case of one man who had those earphones, that thing which comes off on top. No, dust particles cannot be foreign body. Foreign body means actually a foreign body lodged inside. So that person did not know only. Do you know some people are so unaware that sometimes a fly go inside and they are not aware of it? In our cases, like see, the doctors don't get the best of doctors' clinics because when you pay, you don't want intern learning. So we are learned in municipal hospitals where the level of hygiene, where the level of the brain development is not like you and me. They are not all that careful. Don't you think? We are not all that careful. How we fight with our maids. Keep this clean. Wash your hands. Like I remember my maid, she put the dabba in morning class. So I just tell her put the dustbin out. Then she went away in the lift. So I was telling the other maid, no, I come back and I wash my hand when I touch the dustbin. Whatever, dustbin is dustbin. No, we need to wash our hands. So if you understand, their level of understanding is not like us because they have to go to the next job. But that same dustbin hand, she has touched the lift. No, she has touched the lift button. No, okay. So some people are very ignorant. There may be a fly also inside, or the child also may be ignorant. He may not tell his parents, and then there is growth over that. Okay, that pathogen, about that there is growth. Very difficult, but these are truths of life. People are not all that careful, and sometimes low immunity, the person keeps getting chronic infections. So sinusitis, sinus pain and swelling, stuffy nose. What are the symptoms again? Post nasal drip. What is the meaning of this post nasal drip? Behind the nose. So all the time, you know what they will do? And then they'll spit. They'll take it inside and then they'll spit. That is a PND or a post nasal drip. Bad breath again because the bacteria have come in. Sore throat, cough, tiredness, and light fever. Morning time, stuffy nose and cough. We are differentiating between sinusitis and allergies. Stuffy nose and cough lasting longer than 1 to 2 weeks duration. Acute sinusitis lasts less than 4 weeks. Chronic sinusitis lasts 3 months or longer. Now, the symptoms of allergies: runny, stuffy nose, sneezing, wheezing, watery eyes. Now, see, this is an inflammation. Remember those histamine, okay, which I taught you. Sneezing, high level of histamine, wheezing, watering, it's affecting, see, it's ENT, it affects even the eyes. Warning time begins shortly after the exposure to the allergen. So there are people who know they are allergic to this, they will refrain from it and last as long as the exposure is there. Once it's taken away, it subsides. Correct? One minute, huh? Just a minute. I got my dashboard here. Yeah. So symptoms can be rhinorrhea, itching, nasal congestion, obstruction. First symptoms may appear in the newborn, but disease usually starts between 5 to 15. Anybody can tell me in a newborn why they get cold? You'll have grandchildren also. I'm pretty young compared to yours. You'll have experience. I can tell you the pinpoint reason. In the hospital, child contacts cold newborn. Think.
Not exposed much to the environment.
Excellent learning session. Okay.
Because a child can't clear its throat, so takes inhalation through mouth.
So Joe, think. Use your gray cells. Come on, newcomers. Buck up. You can also answer. Bhagavant Bedi.
The
But
nurses go from one patient to another patient. So cross, no.
they are very, very careful.
Strong
Now,
smell of strong smell of medicines and no.
think out of the box. What happens 1 week the child is in the hospital? When I give you the answer, you'll say, oh. Huh? When I give you the answer, you'll say, oh.
Yeah.
I give you the answer. Bolu kya? Or you all still want to think?
No, give the answer, doctor.
The answer, no, too much of beating around the bush, no?
Yeah.
It is because of vaccination. The child is given vaccination 2 days, 3 days, 4 days, and see the reaction. Now go and compare your own children, your own grandchildren, whether it's true or not. That's why in homeopathy, we don't allow, my children are not vaccinated. I am not vaccinated because the body can manage on its own. How many cases of COVID vaccine we are seeing which end in fatality? Haven't you seen people, young people succumbing to death, and then some people will say, oh, it's the vaccine, it's the vaccine, it was not proved no well and it was suddenly new to us. Haven't you all don't say like that?
Yes, yes.
So that's a retaliation of the body. The body does not want the vaccine and the child develops. And in our homeopathy, in our books, there are repertories. I told you, there are dictionaries. When I take a class on homeopathy, I explain very well to you all. So those are my dictionaries. So there is a dictionary by Dr. Fatak. There's a dictionary by, it's known as synthetic repertory or Boric or Clark's or Allen's. And it's written never well since. So you have to ask the patient, you're not well since when? So there is one rubric. Rubrics are known as the, you give me symptom, I translate them into rubrics which are found into the book. So it is written never well since vaccination. So there are remedies to, like a bullseye. If the patient can trace it to that time, that since I'm vaccinated, I'm not keeping well, I'm falling infection, succumbing to more infections. So you can treat the patient. And suppose the child comes to you, the newborn is got to you, and you realize the patient gives you, patient also has to be so smart enough to observe that जब से vaccination लिया तब से सर्दी आया है. Then you give your medicine, it's going to act very well. Otherwise, it is beating around the bush, and the person will tell you homeopathy is slow. homeopathy is not slow, the homeopath is slow. Right? Or
But
the patient.
ma'am, isn't not taking polio vaccine dangerous?
I must send you a dairy milk for this answer. How many people have you seen with polio?
Ma'am, my own cousin.
Go and ask that cousin and give me the answer tomorrow. Polio ka vaccination liya tha ki nahi? He'll tell you liya tha. Homework for you. Go and ask that cousin, did you take polio vaccination? He will tell you, I have taken and still I have got it.
Ma'am, she got it, when she was very young. I mean, just 2-3 years old.
I want
And I don't think she will remember, and her mother, matlab, my chachi is no more. So I don't know whom to ask.
remembering ka we'll see later. Because mothers say if a mother had not given her no, she would tell the child all the time, my galti that I didn't give you. And you got it. She will remember. I'm telling you. We've seen a lot of cases, madam. I'm speaking from experience. I may be much younger. I'm 54. But people get it if they have to get it.
Okay.
Follow?
Yeah. Thanks, ma'am.
So I'm ending the class. It's already 4. We meet tomorrow. I will take part 1 also, and I'll take all polyps, treatment, management. Also, I will be explaining tomorrow. Sometimes what happens, you eat a lot of nice butter laden pav bhaji, and then you get cold cough, and then you get coryza. So it can be related to your diet also. I'm so happy you liked it, Manjusha madam. And be there tomorrow because we will be discussing a lot of sporadic reasons. Okay, it's not just dust, it's not just this thing. Like I remember emotional causes also come up. Exam and then you're sneezing the whole day long. So we will be discussing all these things also. Thank you so much for your appreciation and your kind words. We meet tomorrow at 4 o'clock
Thank
again.
you.
Thank you for the gift of your time, energy, and attention. And Anurag, thank you.
Thank you.
Thank
Thank
you.
you, ma'am. Thank
Thank
you
you, Radha.
all.
But good UK.
Thank you,
Thank
doctor.
you.
Bye, ma'am. Bye, all.